I'm with Mr. Tom Schwarzer. Tom, such a pleasure to see you again, sir. Tom is an amazing person, and we're very grateful to have him in the office. He developed chemo-induced peripheral neuropathy, and he's a pretty lucky guy because about 3 years ago you were diagnosed
That's correct.
with pancreatic cancer.
That's correct.
And 3 years later you're still here, which is a blessing and amazing. But tell us a little bit, the doctor, what he did, and...
Well, my surgeon, Dr. Kubi, who is the greatest surgeon in the world as far as I'm concerned, he told me that he was going to try and save the pancreas by slicing away and doing what they call a whipple.
Mm-hmm.
He got in there and he never found any clean margins, so he couldn't save it. So he took the pancreas, the gallbladder, and the spleen.
Took everything out.
Take everything out. Consequently, I became an instant diabetic.
You have an insulin pump that I could show on your side there.
Yep.
And between that, you have been able, you went through 3 months of chemotherapy.
3 months prior to the surgery, yes.
You developed chemo-induced peripheral neuropathy that you thought you would have to live with.
Correct.
You found us how?
Was a flyer came in the mail and invited us to a seminar, if you will.
Right.
And which you introduced yourself and
told a little bit about our story and our history.
Yeah, that's right.
You came in for an evaluation. They found that you were at a severe level, and you started care.
Yes.
Now, how are you doing overall? Tell me your...
Oh, fantastic. I feel great.
You've had a 50, 60% improvement? What do you think?
Oh, yeah. I would say 50 or 60% improvement. But I've got to tell you, this whacker machine, as I call it, has made a vast difference because I feel so much better after I come out from a session.
And what he's talking about is the shockwave therapy. And I will tell you, you're probably the first male that we know of in the United States documented to use this on peripheral neuropathy. We have one other patient, Miss Carol, who was number one, but you were the second one on that day. And we have followed you over the last 4 weeks, and it has really helped jumpstart your blood flow, your nerves, and it is a shock wave therapy. And it was tender at first, but each session...
To say the least, it was tender, yes. I'll be honest there. And I was reluctant to have the second, but you assured me it wouldn't be as bad, and you were right.
And I lived through it. So what would you tell other people out there who have gone through something similar to you and are on the fence about trying to find some relief?
Well, clearly it's the only thing that you should try. You can try the rest of the protocols, but this one, in my case, was most effective.
Yep, we knocked it out of the park. Thanks again, Tom. You're the man. Are you playing golf still? And doing
Absolutely.
Isn't that amazing? All right, hit him well. Hit him well, and your balance is good.
Yeah, it is good.
Yeah.
Thank you.
Thank you. Bye.